Today you will be learning about congenital insensitivity to pain. Congenital insensitivity to pain, also known as CIP, is a rare genetic disease where an individual cannot perceive any physical pain. This disease is caused by a mutation on the SCN9A gene, which causes insensitivity to pain. The SCN9A gene is a protein coding gene which codes for a particular type of sodium channel protein. This gene is essential for pain nerve system messages. Due to the mutation on the gene, it prevents the brain from interpreting the pain nerves, causing the insensitivity to pain. This disease is also caused by a mutation on the PRDM12 gene. The PRDM12 gene is responsible for developing and creating the pain-sensing nerve cells. Though the idea of not feeling physical pain sounds great, it actually has far more risks than benefits. CIP is an autosomal recessive pattern, which means both copies of the parents have mutations. Symptoms of CIP include anosmia, loss of sense, predisposition to infections, lichenification, deterioration of the joints, and hyperactivity. Anosmia is the loss of smell, and lichenification is thickening of the skin. Keep in mind that individuals with CIP do not have all of these symptoms. In this picture, there is an example of someone with lichenification compared to someone without it. The images also show self-injuries caused due to feeling no pain. As for treatments, there is no known cure for treatment for people with CIP. It is strongly recommended for regularly check for any signs of injury. This Punnett square shows how an individual may only have CIP if both parents are carriers of the disease, which must carry the mutation. CIP is a very rare disease which, for the most part, can be lethal because of the internal injuries that can go undetected. Individuals with CIP tend to have shorter life expectancy, which is why they must also check for injuries. According to the U.S. National Library of Medicine, there are only a few individuals in the world diagnosed with CIP.
Sit back down.
For most 4-year-olds, a bump on the head is followed by an ouch and a painful cry. Not so for Roberto Salazar, who is almost always smiling. Even as a newborn, Roberto never did cry, even when he was being given a shot, or when he should have been hungry.
Eating is supposed to be this inborn thing that everyone wants to do, that, everyone knows how to do.
At 3 months, Roberto just wouldn't eat. His mother had to feed him with an eyedropper. At 8 months, he weighed only 12 pounds. A stomach tube was inserted to force calories into him and to keep him alive. His family knew something was terribly wrong, but were shocked when he began teething.
Roberto didn't like any teething kind of toys. It was always his hands in the mouth constantly. And then he would get his hands bleeding. He had big open sores on his hands.
And it wasn't only his hands. His horrified parents watched as Roberto began to mutilate his own tongue and his lips.
Gotta get in the car.
In desperation, Roberto's mother took him to see dozens of doctors. None had helpful answers. Susan found Dr. Felicia Axelrod, a specialist in a very rare set of disorders.
All of the children with HSAN live in a world without pain. The body wants to have input. The body needs sensation to come into it so that it can process, so it can develop, so the brain can be stimulated.
HSAN, or Hereditary and Sensory Autonomic Neuropathies, is a group of 7 rare disorders. It affects the autonomic nervous system, a system regulating blood pressure, heart rate, sweating, and tearing in the eyes. At varying degrees, children with these diseases feel very little to no pain at all.
When one hears that a child lives in a world without pain, you would think that this is an idyllic world. But actually, pain is a very important function. It helps us protect ourselves from injury, to know when we should stop doing something.
More? You want more tickles?
Roberto can feel touch, even tickles on the tummy, but he does not feel pain. He cannot sweat or regulate his own body temperature, making air conditioning in the summer a matter of life or death.
1, 2, stop.
Roberto's type is the most severe and rare type of HSAN. More than half its victims die by age 3. Ironically, this severe condition often is combined with hyperactivity, Roberto now takes Ritalin.
If you can imagine lacking the ability to feel pain and hyperactivity, it's the deadliest combination that you could put together, especially for a child.
You can't hit her unless she's in a car.
A broken foot, a fractured skull, leaping down entire flights of stairs, even choking. Roberto cannot feel his body telling him to stop.
Mama, hold the tube.
It is estimated that in order for him to feel pain, the action has to be 100 times greater than a normal person's threshold. That is, if he feels it at all.
When he does things, he does it with the intensity 100 times like we do it, because you don't get the input back.
Doctors say Roberto will be wheelchair-bound by the age of 10, a result of the wear and tear he does to his own body every day. There are only 17 surviving children in the United States with this condition. No matter how severe, HSAN is a genetic disorder. Both parents carry the gene mutation. There is up to a 25% chance of developing it with each pregnancy. There is no cure or treatment. Therapy deals with the symptom, not stopping the disorder.
The most challenging and frustrating thing about this disorder is that you can't treat everybody the same way. And then the other frustration is that we don't have a definitive therapy.
For kids like Roberto, it's going to be a lifelong struggle. But it is possible to live a happy, albeit pain-free life. Dr. Sanjay Gupta, CNN, Atlanta.
Well, this concludes my video, and thank you for watching.